Good day, everyone. This is Senior Clerk Murielle Cubelo, and today's topic for our OB-GYN vlogs is COVID-19 and pregnancy and the frequently asked questions about COVID-19 vaccination. So what is the definition for COVID-19 in pregnancy? The case definitions for COVID-19 in pregnant women are no different from that of the general population. The terms suspected case, probable case, and confirmed case are also used. Therefore, all pregnant women with symptoms associated to COVID-19 infection should be tested. Testing should also be considered in pregnant women with increased exposure to the disease. For the effects, being pregnant is not an additional risk for getting COVID, but we also know that there are risks of having one. This includes that pregnant women are at higher risk for getting severe COVID and at a higher risk of delivering a baby prematurely. What's important is that you know what to do if you have COVID, and if you have fever, cough, difficulty of breathing, is to seek medical care early. This can help minimize the risks. In terms for risk for the baby, mother-to-baby transmission in utero during birth is very rare and no active virus has been identified in breast milk. So therefore, it is important to keep continuing with breastfeeding. And as far as we know, babies born to women who have had or currently have COVID do well and generally doesn't present with symptoms. In case newborns are infected, most of the time they present with symptoms that are not very severe. Preparedness is very important here. Make sure you know where to go if your symptoms worsen or if you have any other complications. And I can't emphasize enough the importance of keeping regular pregnancy and post-pregnancy checkups. So let's say a mom comes to you and says, "I'm pregnant, how can I protect myself against COVID?" Therefore, the prevention of COVID-19 in pregnancy is pregnant women should take the same precautions to avoid COVID-19 infection as other people. Measure to protect yourself and those around you, which includes keeping space between yourself and other people, avoiding crowded spaces, and keeping rooms well ventilated. Second, wearing a mask and practicing respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Third is to wash your hands frequently with alcohol-based or with soap and water. Fourth is if you have fever, cough, or difficulty breathing, seek medical care early. And of course, get vaccinated. If you wish to do so, do this after consultation with your healthcare provider. The last one is information and frequently asked questions about vaccination. For the first question, can pregnant women get vaccinated against COVID-19? So COVID-19 vaccination is recommended for all people who are pregnant, breastfeeding, trying to get pregnant, or might become pregnant in the future. Before getting vaccinated, pregnant women should discuss with their healthcare provider whether the benefits of vaccination outweigh the potential risks. The benefits may be greatest for pregnant women at high risk of COVID-19 such as frontline health workers, people in high transmission areas, and those with health conditions like hypertension and diabetes that add to the risk of severe disease. Second question, when can pregnant women get vaccinated against COVID-19? So initial COVID vaccines and boosters can be given in all 3 trimesters and if a woman is breastfeeding. It is recommended since people who were vaccinated for COVID-19 during pregnancy and then gave birth passed their COVID-19 antibodies to their newborns. Third question, will the COVID-19 vaccine affect my fertility? The answer is no. Getting COVID-19 vaccine will not affect your fertility. Women actively trying to conceive may be vaccinated with the current COVID-19 vaccines. There is no reason to delay pregnancy after completing the vaccine series. For the last question, can pregnant women receive COVID-19 vaccine booster shot? The answer is yes. All individuals aged 18 years and older who receive an initial COVID-19 vaccine or vaccine series should receive a single booster dose of COVID-19 vaccine at least 3 months from their second vaccine dose. Thanks for watching for another OB-GYN vlog. See you on the next episode.